Let's talk depression. This is the second video, and in this video I'm going to talk about how depression is presented and how does it affect us. Video number 3 will be the management of depression. Now, what happens in depression? I always say, if you are sleeping okay, there is no change in your sleep, there is no change in your appetite, and you are waking up in good mood, you are in good mental health. What happens in depression? Biological functions, sleep, appetite, libido, they get disturbed. Our sleep goes first, we start losing interest in food, and we start losing interest in pleasures in life. Then what happens? It starts having psychological effects on us. Our mood starts getting low. We start waking up groggy. We start waking up not looking forward to the day. And it takes a while for us to start feeling better. Then it develops a bit further with negative cognitions. We start looking at things in a negative aspect. Glass is always half empty. We start remaining sad and miserable, and the level of our miserability, our lack of interest in life keeps on increasing. We just stop enjoying things. Then some of us with depression start developing somatic symptoms. That means body aches and pains, lethargy. We start feeling sometimes unusual symptoms like difficulty in swallowing, a bit of an anxiety in us, a bit of a sadness. And this is all depression. Now, if this state continues, if we don't do anything about it, it's only going to get worse. So you got to do something about it. That will be the third video. But in this video, I want to focus on things like sleep, appetite, interest in life, waking up groggy with low mood, and it's just a constant state of unhappiness. And this is the way depression is. You see your life as negative, bleak, and the future as bleak, even if it has nothing to do with reality. But it is the perception we develop when we are depressed. Nothing is just of any interest to us. That's how depression presents. It is a dreadful state of mind. It affects a lot of us. The prevalence is very high. The way I see it is that in a lifespan of 60, 70, 80 years, it's unlikely that we go through so many decades of life without experiencing even mild depression. The difference between mild, moderate, and severe is that in mild and moderate depression, the symptoms I have described is just a change in the intensity. If they become more intense, it becomes more moderate depression. But in severe depression, two things additional comes in play. One, we may start feeling ending our life. Things become so serious and negative that we start thinking that what is the point in living? Number 2, sometimes our mind goes into a state of distortion, distorted reality. Hence we start experiencing things like paranoia. Technically we call it psychosis. We may start thinking negative to the extent that we start denying even our own self and our own existence. These are the two additional things in severe depression. If you are severely depressed, that it needs treatment. Treatment is must. Mild to moderate, you can get away with psychological therapies without even taking medication. But I'm going to talk in the third video about the management of depression. For this video, it was the way it presents, the way we feel. Just remember, sleep, appetite, interest in our day-to-day life, waking up in bad mood, which gets better as the day gets along, but in moderate to severe depression, the mood doesn't get better as the day gets along.